Hi, I'd like to share with you a couple of things that I've learned in the last couple of months. I spent almost a month working at Bellevue COVID ward and ICU, and aside from the whole experience, I observed a couple unique things. As you may know, patients often need oxygen support, and that often comes in the form of a mask. And they're also frequently turned prone, meaning to lay on their stomach. And one thing I observed there were several cases of severe skin injury to the nose, to the bridge of the nose, and less frequently to the lip from wearing different oxygen appliances while being in the prone position, including skin loss, really bad things. At the same time, I was watching, like we all have been, TV, and noticed that there are a lot of people that are wearing their masks really tight, and started seeing red marks on the bridge of the nose, and kind of connected the dots. And I think it's important for people to understand on the non-hospitalization, non-intensive care unit side that we all need to be careful. Obviously we're wearing masks, but we need to be careful that the mask isn't too tight, especially on the bridge of the nose. If you pinch it too tight and you see that there's redness that remains on your nose more than half an hour after you remove the mask, then you essentially have a first-degree kind of injury similar to a sunburn. If you're wearing it tight and start to see a blister, then it's more of a second-degree injury, which could even go on to form a scar. I think it's important, obviously, that we wear our masks well, and that protects those around us as well as ourselves, especially if it's a more advanced mask. But it's important to understand that from this kind of excess pressure in the area, you may be prone to marks that will be more long-lasting, and particularly hyperpigmentation. So I think it's important to keep an eye on how you're wearing your mask. It shouldn't be red more than half an hour after you take it off. And if you are seeing that, try to adjust the mask, try to avoid those kind of things. And very importantly, when you're getting out in the sun, wear super sunscreen, the highest, SPF that you can, because you're gonna have an increased risk of hyperpigmentation to the area, and that can last a long time and be very difficult to get rid of. So hopefully this is useful. On the more intense side, there are also modifications being done to help prevent these injuries. Unfortunately, all this stuff came so fast that it takes time to get the right accommodation so that patients can be taken care of without these injuries. So thank you.